Hi everybody, this is Dr. Kennedy Wienikamp here at Fort Collins Chiropractic here in Fort Collins, Colorado. Today I want to talk to you a little bit about how chiropractic applies to a thing called a hiatal hernia. Maybe your physician or someone in your life has maybe told you you might have a hiatal hernia, but they don't know for sure. It's not bad enough to actually go have it surgically operated on, or maybe someone hasn't told you that. Maybe you just have a lot of pressure just up underneath your sternum, or in the base of, just feels like on the bottom part of your sternum, just underneath or behind your chest. There's pressure there. Oftentimes people will go and have EKGs and have an entire cardiac workup, when in fact it's just the stomach pushing up on the diaphragm, causing potentially a hiatal hernia. Now, hiatal hernia is where we have different holes in the diaphragm. That's the easiest way to say it. My throat goes through this hole, goes through this muscle called the diaphragm, and down into all this area down here where the guts are located. Okay, so that goes into the stomach, right? You have other holes in your diaphragm, something that gives way to the aorta, something that gives way to the vena cava, the largest vein in the body. Most of the time, though, people will have like acid reflux or just a lot of pressure, or almost a ulcerative type of feeling in their throat or in their stomach, and oftentimes that's a hiatal hernia. And what that is sometimes people will bend over and they'll go to lift something, but it'll be kind of at an oblique angle, or they don't have a very good angle on it, or they're not in a very good position to lift, and they'll go to lift and they'll grunt. They'll just go like that, and it'll shove their guts into funny directions that this part of the body wasn't prepared to do. They didn't realize that was that heavy. They thought it was lighter, so I was just going to pick it up nice and easy from this funny position. Let alone how bad that is for your back. Your stomach can actually be forced up into that little O-ring. Now all of a sudden that's next to your throat pipe, okay? And you're going, oh, and the esophagus is going, oh. And then might even start gathering gas up into that little piece that's up in that ring, okay? So it's not designed to be up in there. What we do at our office is I actually just very gently reach up and use manipulation of your internal organs. And it's very gentle, and we pull that back down, and it's amazing to see the reaction on patients' faces as they're like, oh my gosh, that is the first thing that finally has gotten to the problem. There isn't a pill big enough or strong enough to move mechanically that portion of your stomach out of that ring, okay? And you have to remember that. I had a guy tell me one time, the only way to actually get that out of there, as far as in pill form, is if you have a pallet of pills fall on top of you. That might do it. But anyway, other than that, you have to physically have that manipulated out of the way. So if you're ever having any problems with kind of acid reflux kind of stuff, abnormal burping or belching, just pain in your guts of any kind, why don't you think about stopping in, and I will take a look and assess and see if you might have a hiatal hernia that we can help with. It's quick, it's easy, but most importantly, it's effective. Till next time, thanks.